Hey, I'm Justine Buick, the NCLEX tutor, where I help nursing students pass the NCLEX and nursing exams. So today I wanted to talk about management of care NCLEX questions and how to eliminate answers. Management of care has a lot of ethical and legal topics on it, and it's a really big section of the NCLEX. So let's get started. So this one right here is a who do you see first type of question. So it's a very common question on the NCLEX. And what you are looking for is the patient who's having the immediate complication. So the nurse is about to make rounds after receiving the change of shift report at 1500. So who should the nurse see first? A 54-year-old client, 4 hours post cardiac catheterization, who has mild discomfort at the access site. So I always want to look at the time frames. Like 4 hours, which would be concerning if it's only been 4 hours. I want to make sure they're not having complications. And the procedure, it was a catheterization. So of course I'm going to be worried about bleeding. But then the sign and symptom data just says that they have mild discomfort at the access site. So that is a common finding and it's not an immediate complication. So I would probably just eliminate that answer. Number 2 is a client newly diagnosed. So I see the word newly, so that's another time frame. And it's telling you that they just have been diagnosed with it. With diabetes mellitus, so there's the condition, who needs reinforcement of sick day management guidelines. So that just tells me that they need some teaching, and typically with teaching, they're almost always going to be extremely stable, so I can probably just eliminate that answer too. A client who arrived 30 minutes ago, so here's the time frame, 30 minutes ago, so there is a higher risk of complications from the post-anesthesia care unit. So all they told me that they're from the PACU, and they don't tell me what they had done, and they don't give me any sign and symptom data. And so I really don't know what's wrong with this patient, but I do know that when patients come back from something, there's always a higher risk of bleeding because they just cut into them, and a higher risk of airway problems because of the anesthesia. So I would keep that one. And then number 4, a client with pneumonia who has received 2 doses of IV antibiotics. So they've got the medicine for their condition, which makes sense. And then the sign and symptom data says they have an oxygen saturation level of 93%. So that's the cutoff point on the NCLEX for oxygen sat level. Anything below that, I would definitely be concerned about airway issues. So that person I can probably just eliminate. And due to the high risk of complications of number 3, I'm going to go with that one. All right, so this next question is an delegation type of question. So these can be really tricky. Which client is most appropriate to assign to an LPN, LVN under the supervision of an RN? So it's just which patient can go to the LPN. And you want to give the most stable patient to this person. And remember, for the RNs, it's good to know what they do. So the RNs, they do all the evaluation, assessment, and the teaching, okay? And LPNs can reteach. So let's go through them. A client with oral cancer, so here's the condition, who is scheduled in the morning for a glossectomy. So that is a procedure that they're going to be getting for their oral cancer, and ectomy is removal of something. But even if you weren't totally sure what that is, they're scheduled in the morning for a procedure. So the first thing you should think of is this person's going to need some teaching. So it's probably not the best one for the LPN, but I would probably keep it because it doesn't sound like they're totally unstable. So number 2, obese client returned, so they just returned from surgery after a vertical banded gastroplasty. So that one there, I would definitely not give that one to the LPN. I would eliminate that one because anyone that's returning after a procedure is going to need a lot of assessment, and that's going to be for the RN. Number 3, client with anorexia nervosa, so they don't like to eat, and it's a psychological issue, who has muscle weakness and decreased urine output. So they're giving you that sign and symptom data, and you always want to pay attention to that. There's always clues for either keeping answers or getting rid of answers. And the decreased urine output is definitely a concern because I'm worried about their kidneys. So that patient is definitely going to need more assessment, and I would eliminate that one and give it to the RN. And then number 4, client with a chronic cough, Okay, so there's the symptom data and clear mucus related to acute bronchitis. So that one right there, they're having the signs and symptoms of the condition, and it's a chronic cough. So they're always kind of coughing, and it's clear mucus. So I'm not worried that they are having an immediate complication. If it was purulent, then I would be worried about an infection, but these are pretty mild symptoms for this condition. So if I had to decide between 1 and 4, I would definitely go with number 4 for the LPN and eliminate number 1 just because of that teaching and going for a procedure. Okay, so this one right here, it looks like it's about advanced directives. A client who is newly admitted request information about advanced directives. So of course you would want to know what advanced directives are. The nurse should include which of the following statements in the discussion, select all that apply. So I know it's the dreaded select all that apply, but it's okay. When you get them, you just want to do your best. So it's just basically, what are you going to do, true or false, for advanced directives? So let's go through them one by one and decide. So an advanced directive may not be changed. So I'm going to eliminate that one because advanced directives can be changed. And what an advanced directive is it includes 2 things. It includes a living will. So that's what the patient says they would like done if they can't make their own decisions. And then it also, advanced directives includes the healthcare proxy, or sometimes they call it the healthcare power of attorney. And that's the person that the patient has designated to make decisions for themselves if the patient can't make their own decisions. But absolutely, they can be changed. So that is false. Advanced directives are only discussed with terminally ill clients. So I'm going to get rid of that because advanced directives by law is supposed to be discussed with anyone who comes into the hospital. And some people don't like the word only. I would definitely not get rid of it or eliminate it just because it says only. I would get rid of it because it's not just terminally ill, it's everybody. So number 3, you will need to designate a relative to act as your healthcare proxy. So that is false also. You would eliminate that one because it doesn't have to be a relative. It can be anyone. Well, it probably can't be the nurse or the doctor, but it can be a friend too. So number 4, I will give you a pamphlet with written information about advanced directives. So that is true. You could definitely do that. Would that be an answer if it was like, what's the most important thing you should do for advanced directives? Probably not. Just give them a pamphlet and say, here, go read it. But it is definitely true, and it's a select all it apply, so I'm going to pick it. And then number 5, a living will is part of an advanced directive. So that is true. Remember I said a living will and healthcare proxy are parts of advanced directives. Okay, so it's 4 and 5. This one is about medications. So a nurse is reviewing healthcare provider prescriptions for a client. Which prescriptions need clarification from the healthcare provider? Select all that apply. So they're not telling you what's wrong with the patient. So what are they getting at here? Well, they just give you this list of meds. So some people might think, well, maybe that's 2 meds. They're not allowed to have those 2 together. But if they don't tell you what's wrong with the patient, then I would just wonder, I wonder if it's how they wrote the order. So let's go through them. Enoxaparin, so far that looks fine. Enoxaparin, 30 milligrams. And by the way, they're never going to test you if you know the actual correct dose on the NCLEX, okay? But although you should definitely know what the correct doses are, but they're not going to test you on that. And then SQ, subcutaneous BID. So that right there, the SQ right away, I know that's one of those unapproved abbreviations, and you would want to know that list of unapproved abbreviations. So I'm going to get rid of that one. I'm going to eliminate that one because I know the content for this. So a lot of the times when you're eliminating answers, what does it come down to? Well, it comes down to knowing the content. And if you don't know the content well enough, it's really, really hard to eliminate answers. And if you are having trouble with content and like what to know, I wrote a book of NCLEX nursing nugget pages, and it's just a book of the most common things that you would get tested on, and there's definitely a part in there about unapproved abbreviations. So it's really good if you just aren't sure what you're supposed to know and you don't want to be overwhelmed with content. So it's 200 pages, and I'll put a link below so that if you want to go check it out. So number 2, oh, and I accidentally, look what I did, I crossed it off, but I meant to circle it, so I just messed up what they were asking. Which ones do you need clarification from? So I would need clarification from this one. So you're looking for the bad answers, right? So sometimes I'll break my answers up. Am I looking for something good or something bad? And I'm going to keep that little mistake in the video so that you guys can see even I mess up sometimes. All right, zolpidem, fine, 5.0 milligrams. So right away, I know that you can't do a trailing zero. So it's not that the doses are, you can't ever look at them. It's just how are they written. So if they don't have a trailing, or if they do have a trailing zero, then you need to call and say, what do you want, 50 or do you want 5? And you definitely want to clarify that, because nurses will end up giving 50 and then kill the patient. So right away, I'm just going to pick that as calling the healthcare provider on that one to see what they actually want. Digoxin, and then 0.125. So right away, they didn't do the preceding zero. So they have to write a preceding zero, because you might mistake it as 125 milligrams. So you have your unapproved abbreviations, and then you have the issues with the doses, and that's the only thing they'll ask you about the doses, except for maybe some math. So I'm going to call about this one. Furosemide, 60 milligrams PO daily. So let me see if there's anything wrong with that. The third thing I want to look at, do they have the 5 med rights correct? So patient, medication, dose, time, and route. So the patient's up here. Medication, dose, the time, daily, and the route. Okay, so good, they had them all. So I don't need a call about that one. MS, so that's another unapproved abbreviation. What is it? Morphine sulfate, magnesium sulfate. What do you want me to give here? So I would call and clarify that one too. So I hope you found that helpful for eliminating answers for management of care. And if you want to see more about what I do, you can go to my website, thenclextutor.com.